Dr. Anthony Fauci, CDC Director Rochelle Walensky, and other top health officials testified before the Senate Health Committee Wednesday about the monkeypox outbreak. In a piece published in the New England Journal of Medicine last month, Fauci co-wrote that, quote, "Lessons learned during the responses to AIDS and COVID-19 should help us to marshal a more efficient and effective response to monkeypox." Fauci has served as the director of the National Institute of Allergy and Infectious Diseases since the HIV/AIDS crisis in 1984. Pointing out his recent piece, Senator Susan Collins asked, quote, "Should we be doing more to look at community spread?"
Thank you, Senator Smith. Senator Collins.
Thank you, Mr. Chairman. Secretary O'Connell, I want to follow up on the statement you just made. I don't recall any requests from the administration to use leftover COVID money for monkeypox. Moreover, it's not at all clear to me that you could not submit a reprogramming request to the Senate Appropriations and House Appropriations Committees for that purpose. So what exactly are you implying when you say that you haven't been able to transfer funds? You've taken funds for other purposes, including sending it to the border.
Senator Collins, thank you so much for your question and for the conversations we've had recently about issues. We've been advised by our legal counsel and by our appropriations team, our budget and finance team, that the money that's currently in the contract for McKesson, which is our distribution network that HCOR is managing, we could not piggyback on that same contract to set up a monkeypox distribution network. The way those funds work, we were restricted to supporting COVID response efforts and not additional response efforts. But I'd be more than happy to meet with you and your team again and see if it's possible to do a reprogramming. But that was what we were advised, and so we took additional funds, different funds, non-COVID funds, and set up a different contract with AmerisourceBergen for the SNS to set up a distribution network.
Let me turn to another issue that we've discussed several times, and I do appreciate the fact that you have made yourself available. We have statements from Dr. Jha, from OMB back in March, that laments the decline of domestic manufacturing for COVID tests. And OMB in its March supplemental request talks about the volatility, which makes it difficult to preserve domestic manufacturing of tests. Dr. Jha says the United States government put a lot of efforts and resources into building up domestic manufacturing, and what we're seeing day by day, week by week, is that that's beginning to go away. I would suggest that it's the administration's contracting policies that have weakened our domestic manufacturing of COVID tests. As you and I have discussed before, the majority of the at-home tests the administration purchased for COVID were manufactured outside of the United States. For example, the administration awarded a Chinese company, iHealth, a $1.3 billion contract. That's roughly 4 times the size of the contract that was awarded to an American company, Abbott, which has a considerable presence in my state. So how is it that the administration is working with domestic testing manufacturing when you're at the same time awarding contracts to Chinese companies? That does not help to preserve domestic manufacturing.
Senator Collins, thank you. Domestic manufacturing of tests is a critical mission of ours in ASPR, making sure it's supported and an enduring part of the COVID-19 response when it moves from an acute response to a steady state. We will always want to know whether we've had COVID, whether someone we've interacted with had COVID. So testing is critical, and domestic manufacturing of tests are also critical. And regarding the iHealth contract, you'll recall when the president made the announcement that he was going to make 1 billion tests available through the U.S. Postal Service distribution system, the covidtest.gov. He also vowed at the time that he would not interrupt the commercial market, that he would not take tests that were currently going to the pharmacies and other stores. He would not take them out of the market and put them into the covidtest.gov program. In order not to disrupt that, the domestic manufacturers at the time were seeding the local pharmacies. We pulled in tests internationally so as not to interfere with what was available at the pharmacies. As soon as that leveled out, we made a commitment in the spring to only support domestic tests moving forward. But that initial decision was to not interrupt the domestic tests that were currently feeding the schools, the pharmacies, and the other pieces of the response. We wanted those to remain available.
Dr. Fauci, I just want to wish you well in your retirement. And a very quick question for you, and it's based on what you've written recently about the lessons of the AIDS pandemic. Though monkeypox cases are overwhelmingly related to sexual transmission and men who have sex with other men, should we be doing more to look at community spread and cases in the broader community, such as, for example, testing anyone with an atypical case of herpes or shingles, regardless of their sexual history?
Thank you for that question, Senator. The answer is yes, we are doing now serosurveys and surveillance that go beyond the well-established high level of infection in certain demographic groups. And that was part of the 5 pillars that I mentioned in my statement about virology, immunology, transmission, reservoirs, and serosurveillance. We're doing that in some of our studies, but the CDC is also doing that, and we're actually doing it in collaboration with them, using some of our cohorts in collaboration with the CDC's capability to do that. Perhaps you want to comment.
Yeah, maybe I will just add, thank you, Dr. Fauci, that among our health advisory networks that we've sent to clinicians and our outreach, for example, to the American Academy of Pediatrics, we make recommendations just like that, that say if there is an atypical rash, please consider monkeypox and test for it on your differential diagnosis. We make those recommendations. Thank you.
Thank you.
Thank you, Senator Collins. We'll turn next to Senator Baldwin.
Thank you, Mr. Chair. First, I'd like to ask unanimous